Hi everyone, my name is Madison and I am working with the East Bay Pioneer paper.
Hi, I'm Tabitha Gonzalez. I previously worked with a nonprofit homeless service provider for about 3 years at an interim housing shelter site in San Jose.
Very nice to meet you. So my first question, getting right into it, my first question is going to be what services are provided to the homeless who have lived at your shelter, and what services do you think should be provided that haven't been already?
So on site, we provided 24/7 access for the clients to resident advocates, which were staff members who were trained to assist clients with finding employment and finding housing, as well as submitting any requests for things like navigating Social Security, navigating obtaining a birth certificate. We did also have clinicians on site for limited hours where they could only provide talk therapy to help provide counseling to clients who are on site. Some services that need to be provided were on-site medical access. A lot of clients did not have access to transportation to obtain medical care, as well as mental health services where medication potentially could be provided as well.
Okay, all right. And then my next question is going to be what policies are put in place to ensure the safety of the individuals who are living at the shelter? And do you think the policies impact the safety of the community, or are they only beneficial for the shelter?
So some things that we did have in place were all the cabins had, so each client was an individual cabin and each person had their own key to their cabin to be able to lock their doors. So they had some privacy. The only person who had a key to the cabin was staff members. This to provide safety for the clients. We also did have strict policies regarding client behavior, such as violence. That was an immediate exit for a client. As far as the community goes, we did site off the side of the freeway next to a public storage to prevent impact on potential neighborhood communities such as schools.
Okay, interesting. What is the turnover rate for those who live at the shelter? And
So
then
our success rate when I left last was about 22% of clients who had a successful exit that deemed that they were able to find and secure some type of long-term housing or living arrangement. This could be living with friends, a roommate, or having their own studio or apartment. It also could be potentially moving out of state to where they had housing. So that was roughly our success rate.
okay. And on average, how long do they stay in the shelter, and is the exit usually willingly or by force?
So our clients were allowed a max of 180 days at our shelter site. Exits, depending on the case, were sometimes behavioral exits where the client was continuously breaking policies such as being aggressive towards staff or other clients. And in those cases, we did have to use force, such as police interventions to exit the client off of our site. Some exits, if they were more positive exits, such as moving into a house, moving in with a friend, finding a place to rent, those generally were by the client's choice and they were much more excited about that.
Piggyback off that.
Mhm.
Clients who have been in the shelter before and then find housing, and if that housing situation doesn't end up working out for them, are they able to come back? Is there like a time period where
There's no time period, however, they'd have to start back into the waiting list. And our waiting list can be up to 40 to 100 people long with only 40 spots at each site location.
okay, okay. And then does the shelter or state provide basic necessities such as food, water, toiletries? And if not, do you think that they should?
We provided basic necessities such as toiletries. They had access to free laundry, free showers. They did not have to pay anything to be there. We provided donated food such as groceries, like we would have whatever was provided by various donors, such as carrots, squashes, bananas, whatever that they had extra. However, pre-made meals were not provided, and that was something that a lot of clients desperately needed, especially those who were coming from being on the streets for a long time. Many of them did not know how to cook for themselves.
Okay. And then what do you think the consequences of the state refusing to help the aid of the homeless population?
I think rises in fires. That was something that we saw a lot in encampments where large encampments would take over an area and you would get breakouts of fires. And that was something that can spread very quickly to surrounding areas, as well as trash and debris, which also can spread diseases, illnesses, and again, fire.
Okay. And then one last question to wrap this up. What do you think that the Bay Area residents can do to contribute help to the homeless population?
I think the biggest thing is allowing service providers to come into their communities and provide services, set up locations, set up sanitary, such as outhouses, showers. A lot of times we receive pushback from communities saying that they did not want that in their neighborhood.
Okay. Well, that's very helpful. Thank you very much for giving your insight about the homeless population. And it was very nice to interview you.
Of course, thank you for having me. It was great to speak with you as well.